Good morning, everybody. Once again, I think this is number 6 in my series. My name is Steve Miller, and I live in Parkland, Florida. And it's 6:29 a.m. on Monday morning, January 18th, and it's anniversary day for me. This is my 5-week anniversary of my inguinal hernia surgery. Mine was open cut with local and conscious sedation, and it's been a bumpy road. I'm not going to lie. If you and I if you watch the other videos in this series, suffice it to say that I don't think it's been bumpier than most. I'm not a kid. I'm 65, and I'm a realist, and I know anytime they cut you and they're inside your body, it's major surgery, even if it's done in an outpatient center. But all in all, today I feel good. Uh, during this time since the procedure, I think it's 3 weeks ago today that I had to have the doctor cut me open again, and he did this in his office and drain my hematoma because it was huge. But if you're watching this video, it means that you're considering having the surgery. I would highly recommend you watching, just googling on YouTubing Brett Jackson inguinal hernia surgery, and he was my inspiration to do these. And his video helped me through the whole procedure, and a lot of the aftermath, as well as PMing back and forth with him. But since my last video, a lot's happened. In the beginning, I was doing them every day and every other day, but I realized that it's a slow process. So the last video I did was a week ago Saturday, which would mean it was 9 days ago. And since that video, I feel better. It's actually really good to say that. I'm not 100% yet, not by any way or possible. Or any thought that might come into my head. There's no way I'm 100%. But Brett told me that the swelling just goes down really quickly. Like all of a sudden, boom, it happens. He's like 3 weeks ahead of me. He's probably on week 8 or 9 right now, and it happened over the last 9 days. All of a sudden, it's early. All of a sudden, the swelling's gone. Just about everywhere except for 2 spots. I have swelling around the incision, and there's not a lot, but there's enough for me to know that it's there. And most of it, if I'm not mistaken, is the healing ridge, scar tissue that's forming, and I have a massage therapist coming over once a week. Untangle my tongue here. It's still early. Massage therapist coming over now once a week, starting tonight, who's going to rub that scar and see if we can just reduce it in size just a little bit. She's also a PT, so she understands how the recovery goes. My doctor approved it, and the other little bit of swelling I have, I don't think she's going to be rubbing. It's on the right side. It's way down low, and it's gotten a lot better than it was before. It was my right testicle, and it's probably halved itself, or if not halved itself, almost halved itself since a week ago Saturday, which is really good. And I have a little pain, and it gnaws at me a little bit, but I know exactly where it's coming from. It's coming from the last little bit of black and blue, the last hematoma that I had that's right beneath the scar, and it almost touches the incision, but it's a little knowledge is good, and that's why I'm doing these things. That alone, without any kind of redness or red streaks coming from the incision, which is completely healed, or nausea or fever or severe pain, that alone, without the other things that I just mentioned, is just a hematoma. And I don't know, your body after a surgery like this, I think, becomes a little creaky, where you turn a little bit and like it's creaky down there, like it hurts, it twinges, you know it's there. But it's okay. It's definitely tolerable. But most importantly, I know that I'm getting better, and that's it's one day at a time. And I know that there's still 10 things that could go wrong with this. Although I guess as time passes, the immediate bad reaction that my body could have to the mesh, uh, which I think which I think is a lot rarer than those attorneys online would like you to believe. As the time goes by, the chances of having an immediate reaction after surgery to that are probably less and less and less. Uh, and I never was particularly worried about that. I mean, they do 800,000 of these operations in the United States, inguinal hernia operations every year, and if it was such a horrible, devil's tool to work with, I don't think that they'd be doing that many and using that particular uh, way of doing it. I do know that they don't use the tension method anymore like our grandparents used to have, and that's simply because sewing muscle against muscle and having to trim the edges and making sure you're attaching healthy tissue to healthy tissue creates a lot of tension down there, and it makes it easier to tear it and all of a sudden have your hernia pop back up, so to speak. So I think the mesh is fine for right now. You'll be able to feel the mesh. You'll know exactly where it is, just from like your little coughs and stuff like that, or when you sneeze, you use your hand when you feel like you're going to sneeze, or when you feel like you're going to cough, or when you're defecating, as a negative force against the area that's been meshed in your body. You'll know where it is, and what you're doing is you're basically just holding everything in place until you know, uh, until enough tissue forms around that mesh to make it one with your body. And I believe after 4 weeks, you're enough there that any chance of ripping it easily really just kind of sort of fades. I don't think anybody's particularly safe yet. I know that I'm not because the doc has told me no weights, can't touch the weights. But the improvement that I've made, excuse me, between last that's coffee, boy, I need it. Uh, Between last Saturday, 9 days ago, and today has really been dramatic. Uh, I feel good most of the time. Like right now, I feel good, although I woke up feeling a little stiff by the incision, so I have a heating pad on there now. And from everything that I've read and my own personal, try it and see if I like it kind of deal, I believe that the heat is a much better treatment at this time instead of the ice. The ice is like a band aid. If you have a pain, yeah, all of a sudden you're numb. But it's not treating the root, which in my case is the hematoma. Uh, so that's important, and I'm staying away from the ice. I don't go near it. I don't even bother with the Aleve anymore because I think that this is a natural process now. There's certainly no need for painkiller. I don't use Tylenol or Aleve for that, but I was using Aleve for a little bit as a swelling reducer, an anti-inflammatory, but it didn't seem to work, and I think that's because the body's going to do what it does naturally, and I can't control it. So I'm going to go back and see the doc in a couple of weeks, probably when I think I feel up to lifting weights, but I have to ask his permission, and I know we start light. But for now, in the last 9 days, I've really increased my exercise, and it's not what I'm used to, but it's a great feeling. Hey, we got these smartphones, and we should use them. I don't know. I'm not one of those Samsung watch wearers, but I use Android. What do you call it? It's a Samsung app actually, and I'm sure Apple has one too. The fitness app, and I went from taking just a nice long walk every couple of days to sort of like I guess what power walking would be. I've never power walked. I've always been a runner or an elliptical person, but I'm walking 2.5 miles, 3 miles a day right now, and I'm I'm walking quickly. I'm getting my 8,000 to 9,000 strides in doing that, and or steps, and I'm putting in 45 minutes to an hour every day, and it feels good. I was a little sore yesterday afterwards, and I'm still a little sore today, and I might take the day off. I've gone 3 days in a row, but it's a very rewarding feeling to come on in the house and take a nice hot shower afterwards, And then I had a milestone this morning. Woke up and I was curious as hell. I've been living in baggy sweatpants and baseball jerseys for the last 6 weeks and 5 weeks, excuse me, 5 weeks today. And I was curious, so I tried on my jeans, a bunch of my jeans, and they fit. Well, I knew they were going to fit, but I've lost weight, but it's muscle weight. But I was real excited, like I can go out of the house and right over to the grocery store now and look like a human being, as opposed to this little old man in a sweatsuit. Although I'll never wear a members only jacket to go along with the goddamn pants. But yeah, I'm just tired of the sweatpants. I mean, it's like going out in your pajamas every day. So now they become a comfort item around the house as opposed to a necessity, and I'm really glad to be able to do that. I know this video is a little more upbeat than some of the other ones that I've done, but I chronicle the truth, and if you need to watch this, and you need to watch all of them if you're considering the surgery, or at least bits and pieces. And I'm not tooting my horn and saying what I'm doing here is like it's Shakespeare or even Michael Bay, but I'm telling the truth. If you were to Google taking care of your hernia at home, okay, afterwards, your hernia surgery, excuse me, you'd find sites, and I'm gonna mention names where I can remember them, like Alberta, Canada. They tell you there's a site there that tells you like what should happen in week 1, week 2, week 3, week 4. It's all bullshit. Put it aside. It means nothing. It makes you feel like you're sick, and it's frightening to watch those things or read those things because they're basically telling you that you can go back to a normal life and be 95% after 4 weeks, and that's absolute bullshit. You're weak. After 4 weeks or even after 5 weeks, I'm weak. I haven't done anything physical in 2 months except my walking, 2.5 months from diagnosis to surgery time. Might even be a little longer than that now because I had the surgery 5 weeks ago. So consequently, I have no muscle. I mean, I know what I weigh, and I know my waist is pretty much the same. I haven't gained any weight in my waist because I can fit in my jeans easily. And so I know that there are things that I can't. Let me give you a couple for instances, okay? Uh, I walk upstairs easily now. Okay, it's not that one step shuffle that all the 90-year-old people do. I can get up the stairs, but I have in one of the sinks in the master bathroom. There's a bit of a blockage. It's the sink I shave in, and I have a plunger that's probably about a foot long that's made for sinks, and it always works. It hurts me in my incision area to plunge that sink with a plunger that's made out of plastic that weighs about maybe 4 or 5 ounces. Can't do it. Uh, it's the up and down motion, and it's more, I think, like the leaning into it a little bit. Uh, I won't carry a, uh, what do you call it? An Avion box, a water, 1 liter box of 12 waters up a flight of stairs, bring it upstairs in the house. I won't do that. I won't carry a 12 pack of Gatorade upstairs, just as an example. I won't do that either. The most weight I've lifted since this hernia ordeal, if you want to call it that, has started has been my 20-pound Shih Tzu, and I do it in a special way. And still, if I lift him using my legs only, which is an accepted way, and it's certainly not too heavy to lift him now after 5 weeks, I'll get down beneath him and actually push him up onto the couch and help him. Okay, and he can hop up on the chair here with me, but I try to pick him up the least amount of time as possible. But that's the only weight that I've lifted. So no, you're not even close to normal. And they tell you on some of these blogs that you can go back to work in 4 or 5 days. Capital bullshit with a B. These are doctors looking to make a quick buck and not giving a good flying fuck about how you feel afterwards, and how angry you could possibly be at them, for promising you something that ain't gonna happen. But and I could go on and on, but just making the point. Hopefully, we'll get people to look at those vlogs and know that everybody heals differently. And I was kind of worried a couple of weeks ago because after my second follow up with my doctor, the week after he opened me up and drained that hematoma, I went to see him and I was concerned. And I said, "Geez, I'm all swollen still. I got these horrible hematomas, and I'm swollen down below on the right side." And he said, "It's just time now." He said, "Everything is fine." And I decided just to let it go and trust him. And because he told me the truth the whole time, he did a beautiful job. And I feel good. And that's really what I wanted to say today is that it's 5 weeks, and I finally can say that probably about 70% of the time I feel good and I'm pain free. You'll always know it's there. Just so you know, you'll always, at least at this point in my recovery, I always know it's there. I just know it's maybe because I'm thinking about it, but the bottom line really is that so it's 5 weeks and I can pretty much do whatever I want to do except what I really want to do, which I've been told is going to take a couple more months at least, and that's lifting, and like I said, I feel weak, as weak as a kitten, but hey, listen, I had hernia surgery, and here comes the moral of the story. I had to have it. Okay, I'm gonna tell one quick story here, and then I'm gonna get off this this video and be done with it. And about I don't know, I think it was back in 2017. I took a cardiolite stress test, and I've been taking them every 2 or 3 years my whole adult life. There's a history of heart disease in my family. My father passed away of a heart attack, and he was pretty sick during his life. And being that I'm a runner, I'm an elliptical person, and I still lift at my age, I always thought that it was a good idea just to keep on top of it and always just see if everything was okay. And I would check every couple of 3 years. And about 3 years ago, I had a stress test that came back positive. And I didn't feel lousy. I felt great. And the doctor said, based on the test, you could have a couple of major blockages. And I was like, wow, that is messed up. So I kind of freaked. I scheduled an appointment with a surgeon, and I had to have an angiogram done. And it was a false positive. I had nothing wrong. There were no blockages. I remember because you're awake during that. The doc walks around the curtain, and he said, "Well," he said, "I don't see any blockages. You have no blockages in there, and a little bit that you might have, a little bit of buildup." He said, "Is nothing." He said, "It would be considered mild at the worst." He said, "Keep doing what you're doing, and you live to be 150 years old, and it ain't the heart that's going to get you." So it was very reassuring, but I did not want to take that angiogram. That was the last thing I wanted to do. I was terrified, and I think I was more terrified of what the results would be. But I took it. I took it with dignity, and I realized something. That the knowledge is power. It's once it doesn't matter how you get to that power feeling, but just knowing that you're okay or knowing what's wrong is a whole hell of a lot better than burying your head in the sand like an ostrich. And I always knew that, and I knew that I didn't have a choice. I had to take that. Well, hernia surgery is the same thing. It's unpleasant, and I've talked about this in some of my other videos, so I'm not going to harp on it. But it's absolutely necessary. If you have a hernia, the wait and watch approach doesn't work for active people. My urologist who diagnosed me told me that. He said, "It's not going to work for you." He said, "You're too active. It's just not going to work." So I tried it for about 2 weeks, and I thought, this is absolute bullshit. I mean, just let's get it done. And that's how I came to having the surgery. A month after I was diagnosed. But and it wasn't the large hernia until the doctor opened me up and told me after the fact that it was a large hernia. And I guess some of them you just can't feel from the outside. Size wise. He had to put a mesh in the mesh. I believe he put it on both sides, and he also had to put a plug in as well. And that's a hernia that's just from wear and tear over the years. It wasn't one of those indirect hernias. I think that's what they call the ones you're born with. It was a direct hernia. Maybe I have it backwards, but I wasn't born with it. I kind of kind of nurtured it and grew it over the years till it was diagnosable. So the bottom line is, this is a surgery that's a must. You don't want to wake up one morning with a bowel obstruction because your hernia has become strangulated or at the very least incarcerated. It's a simple surgery with zero risk, just about, uh, up until that point. Then it becomes major, major, major surgery, and it could be very dangerous, depending upon how much of your bowel has lost blood, if any, and has to be resectioned. So it's a surgery you got to have. So if you got to have it, you might as well have a lot of knowledge to go along with it and back it up. And don't be afraid to know, because not knowing is a lot scarier than knowing and understanding what you have to do to make yourself well again. And that goes with anything that happens to you. So, at any rate, that's all I got today. I just wanted to, give everybody that update. I want people that want to watch. I want the few people, because this is a niche video, that have watched these videos to know that they have to have the surgery. Believe half the bullshit you're told by the doctor, and just have it. Uh, I take that back. Believe half the bullshit you read online by doctors that are soliciting. Okay, find a doctor you trust who will tell you the square biz, no bullshit truth. He doesn't have to be your best friend. Doesn't have to be your brother. Okay, he just has to be an honest guy. My doc is really a good doc. I trust him implicitly. Communication, okay. He doesn't know me from Adam when I walk out of there, especially with the masks that we wear. Although he's seen me unmasked in a lot of places. Uh, it's uh, it's just something you have to have. So as long as you trust the guy who's doing it, you're halfway home. So I've learned to trust my doctor, and I'll go back and see him again in a couple of weeks, uh, of my own free will, not because I have to, uh, because I still don't think he understands the fact that people my age can actually go out there and exercise like a young man. I've been doing it for 35 years, so this is what my body's used to. So anyway, I wish everybody well. Let's stay safe from COVID, everyone. I take my second vaccine on February 4th. If the state of Florida has chosen to put away some, and hopefully we can get back to some sort of regular life here. And that's a week after that is haircut day, so I'm looking forward to that. This is since March. This was my COVID cut, and just wanted to be gone. I ate it. So that's it, everybody. I'll probably post another one of these in a week, because I'm kind of curious how quickly this this hematoma resolves, and consequently, the last little bit of pain that I have is resolved as well. And by the way, it's normal to have twinges and burning pain, just like on and off, and and just through the initial year at least, from everything that I've been told and I've read. So pain is a warning, but it doesn't necessarily have to be